Thanks, Lauren. Freelance journalist Ashoka Mukpo is now the second Ebola patient to be treated at the University of Nebraska Medical Center in Omaha.
With patients being treated for the deadly virus just a couple hours away, some people are on edge about the close proximity. Reporter Kelly Baumgarten follows up with a local doctor about the issue.
Anxiety over the Ebola virus in Nebraska has reached a fever pitch.
For somebody to come over and, have a whole new disease, it worries me tremendously.
It's really scary. I would stay away from Omaha. I'd stay away from any place close.
I have a concern that it's happening overseas in Africa, and they're bringing them to Nebraska and, closer to home here.
It's bad. It is. I mean, I didn't think it was this close. It is getting close.
But are those fears justified? One local infectious disease doctor says Nebraskans have nothing to worry about.
This is the highest safety biocontainment unit that you can have in the country. And that's why the patients came here, because, Nebraska Medical Center can handle that.
Dr. Daniel Berlita is an infectious disease specialist at Mary Lanning Healthcare. He says the deadly virus is transmitted through bodily fluids, and that's one of the main reasons why the United States is able to contain it.
The overall risk of Ebola outbreak in the United States remains very low. That's what CDC has said repeatedly, and it's based on the fact that we know how to contain Ebola because it's not transmitted like a flu. It's not transmitted by air.
The first patient to be treated for Ebola at UNMC, Richard Sacra, was released and is now Ebola-free.
I think this is good for, just showing what University of Nebraska is actually capable to treat and do, and there is no risk at this point for general public at all.
Reporting in Hastings, Kelly Baumgarten, NBC Nebraska News.
Dr. Berlita says Mary Lanning does have a plan in place based on CDC recommendations. It includes training all hospital workers on how to deal with an Ebola outbreak.